I'm Dr. Louis Feliz, and I got involved with Spring Branch Community Health Center before it started in April of 2003. At that time, the churches in Spring Branch and in Memorial were concerned about the lack of care in Spring Branch. And churches were St. John Vianney, Memorial Drive Presbyterian, St. Cecilia's, Memorial Drive Methodist Church, Chapelwood Methodist Church, St. Jerome's Catholic Church. And these were the original people to discuss how to help Spring Branch with medical services. At that meeting, a young doctor by the name of Pat McAllister got up. He was a young faculty member at the Baylor College of Medicine, and he worked in the Harris County clinics that Baylor ran. And he got up and said, what you ought to do is form a federally qualified clinic. And he said, I work for one in Louisiana, I know something about it, and I will help you form a federally qualified clinic. The state had put out an offer that they would give $250,000 if people wanted to start up a clinic, and we applied. We opened the clinic up in May of 2004. We originally had it open a couple days a week, then got to 3 days a week, and it became clear at that time what the biggest issue was in Spring Branch. And I think that's the defining moment of we established who we were. And at that time, there was no OB care for anybody. There was not the CHIP program, which state now pays for pregnant women. There was no program, and the women would wind up not getting care and walking into the emergency room when they were ready to deliver, which is a terrible way to practice medicine. So we decided that we were going to open up 1 day a week. We applied for federal funds in early 2005. Once we got the federal funds, we opened up the clinic 5 days a week for the prenatal care. Another significant event happened. Marlon Trillo, she was one of the original board members, came to me and said, I grew up in this community, I don't know anything about healthcare, but I really have a passion, I want to help. She had just finished her MBA in finance, so I looked at her and I said, Marlon, you don't know anything about healthcare, I'll teach you about it, but you know something about finance. So we hired her, and a year and a half later, she became the acting CEO, and ever since then, she's been our CEO since late 2006, early 2007. So that was really significant because of her dedication to the clinic, her early interest in healthcare of the people in the community.
We started in the Spring Branch community. We started with a small location and just with 4 exam rooms, and we clearly, very quickly, early on, saw the need for more services to be provided to the community. We added another 4 exam rooms at the very beginning, ended up with a total of 8 exam rooms to serve the community, and that still wasn't enough. So we kept looking for opportunities to grow in the Spring Branch community, and after we opened 2 of our locations in Spring Branch, we noticed that there was a trend of community residents moving to West Houston. Some of the community members that we were serving for many years were moving to Katy, were moving to Cy-Fair, were moving to the Bear Creek area. So we looked at the map and saw that there was a larger need west of Spring Branch, and I think that's when we started looking at the other neighborhoods in order to serve the needs of the community. A lot of our successes in the community have been through the partnerships that we have built in the Spring Branch community, the 15 years of relationships that we have with all the partners, making sure that we're able to connect the dots and serve the community. I think that has been great for our organization. And there's still many more partners to build throughout the West Houston and Northwest area, but we really created a solid foundation in the Spring Branch community with our community partners.
Spring Branch Community Health Center is a very important part of the partnership that we have, a vital member of the community, because when we did the need assessment of the community that we served back in '97, the access to quality and affordable health care emerged as one of the top needs that the community was searching to mitigate. So when the work was done to create Spring Branch Community Health Center, it was really eyeing how it could better fit and can better serve the community, because we needed someone who was affordable, we needed someone that was high quality, we needed someone who could respond to the needs of the community. The fact of having a quality healthcare provider on site that is able to see the wide gamut of clients that come in, from PD to OB cases and some specialized medicine, that works in collaboration with the other partners as well, has really been a godsend. We are so proud that in 2009, they came on site providing health care.
Our partnership with the Spring Branch Community Health Center lives at many different levels. It's everything from bringing experts in to help our students who need prenatal parenting classes, if they're going to be teen moms, to connecting with our nurses and making sure that there's a really good rapport and relationship there, and that there's two-way communication and opportunity, to make sure there's collaboration, to see our nurses working alongside the nurses from the Spring Branch Community Health Center to give hundreds and hundreds of kids vaccines that they desperately need in order to be ready to start school on the first day of school, and to see all the different ways, parent classes that happen at Landrum Middle School. Wherever there's a need, the Spring Branch Community Health Center is there. To have a long-term partnership with an organization like the Spring Branch Community Health Center means so much to our school district. It's one thing to have a partner who very generously pushes in opportunities to provide support for kids for a year or two or three, but to have the longevity of a partnership where year in and year out, you can count on those partners to be there. I remember being at the very first ribbon cutting for the Spring Branch Community Health Center and thinking, wow, this is just a tiny little endeavor, but it's going to have huge impact. And then to see how many locations have been added and how many thousands of people we have been able to serve over the long term is really remarkable. And I just wish very much continued success and much more longevity. I hope we're back on video 15 years from now, celebrating the next 15 years when we get to 30.
Spring Branch has developed key relationships with the educational institutions here, with Spring Spirits, again, with the faith community, with business partners, from backpack drives to immunizations to dental work to services provided to women and families. Healthcare has just been such a good collaborative effort. And quite frankly, we need to see more of that throughout our community, as good partners working together to be as efficient and as effective as Spring Branch has been. We'd like to think of our relationship as a two-way street of a trusted advisor, a client. We've been involved with over 10 years as a bank and as a partner, community connector, just an advocate for their good work. Healthcare is complicated for all of us, particularly if you're a first-generation resident or new to the healthcare system. It really takes a community partner and advocate like Spring Branch to help navigate healthcare. We all need healthcare, and Spring Branch has done a terrific job of being a great partner for folks who are fairly new to the healthcare system and may have limited resources and a limited ability to pay for services. But that doesn't stop them from providing top quality, very high quality healthcare.
So this year we're celebrating our 15 years of serving the community. I think it's a huge milestone. I never imagined that after 15 years we'd have 6 locations, a mobile health clinic. We are looking to open up, a few more clinics next year. And we also received a new grant to buy a new mobile health clinic. So just watching us grow, we're still an adolescent, we're 15 years old, but we've been able to grow because we have friends, because we have supporters, and everyone that really believes in our mission and believes in what we're doing to serve others and really create a much healthier community. And for that, I thank our supporters and I thank our friends and I thank our employees, because without them, we wouldn't have the organization that we have.